Facebook. Thank you for watching right now. We're jumping right into it today. I know we're a minute behind, but we're going to jump right into a couple different things. First thing that we're going to really go through is posture. Once again, we're hearing it over and over from our patients that it is very difficult for them to continue to have good posture, good workplace ergonomics. So we're going to hit this again. We're going to talk today about what good posture is and some simple causes of what gives you bad posture. We'll talk maybe a little bit about what to correct in a different video, but for right now, let's talk a little bit about posture. So what we're going to do is we're going to use Dr. Botros today. He's going to be my model. We're finally fulfilling one of his lifelong dreams to become a model.
Today
Today is his day. So Dr. Botros, let's talk about good posture. So to you, what is good posture?
So good posture really starts with feeling comfortable in your body. And more specifically, when you have a professional looking at your posture, it's really important to make sure that your body is oriented in its proper alignment and where it takes less stress off the spine. So when we have poor posture, we tend to put more stress points in these different areas, and over time, it can really start to aggravate the body.
Leads to a lot of breakdown. The single largest reason that people go to a doctor in the United States is actually low back pain. That's the single largest reason that people go to a doctor. And so a lot of those issues stem from all of this poor posture. So let's talk about what good posture is. When we look at a patient and we look for good posture, essentially what we're assessing is if we look at you from the side, patient's ear is over their shoulder, over their hip, and over their ankle. When we look at them straight on, we want to make sure that their shoulders are level, their hips are level, and they're in a relaxed position. A great way for us to test this is simply by using a wall. So I'm going to have you come stand over here. When we have him come stand at the wall, and if you come over to the side here and kind of take a look at him from the side, when we have him up against the wall, what we should be able to do is have his head, shoulders, pelvis, and feet all equally against the wall. And it should be in a relaxed position. We shouldn't see any kind of stress or straining. You shouldn't be looking up or looking down or rounded in any of those directions. If we see that, then we know that there's deficiencies in those zones, and we really want to avoid that. A lot of our patients that try to get into this position because their head is so forward will start tipping their head back to get into that zone, but we don't want that. Exactly right. We need those eyes to be nice and level, and that is essentially in good posture. And when he steps away from that wall, that's the feeling. That's what most people are doing, yes. But that feeling is what you should be doing. So at home, give this a test. See what this feels like. Does it feel like you're able to stand up straight, or does it feel like this is really hard for us to get into? Make sense?
It makes perfect sense.
Awesome. So let's talk about what are some of the reasons that people can get into a poor posture. So when we talk about patients and we talk about our daily lives, one of the big issues comes from what we do on our daily life. There's a doctor, Dr. Yanda, who was out of the Czech Republic, and he studied patients' postures. And he studied people that were just walking around and said, you know, a lot of these characteristics are simply into one big bucket. Over 60% of people do this activity every single day for too long of a period of time. What is that activity? It's sitting. People, when they get up in the morning, what do? They come downstairs, they go and they sit and they eat their breakfast. And then they get up and they, most of the time, get in a car and they drive to work. Now, for these days, you're going to your living room and you're sitting at work, which could be even worse because now you're not working in a good chair, you're sitting on the couch, or you're sitting on a hard chair from your dining table. And that, once again, is not what we're looking for. So when they're at work, what do? They get up and they go and they have lunch. And they sit and eat lunch for an hour, and then they get up and they go sit down back at work. And they work for an hour, and they get up and they get back in their car and they go home, and then they eat, and then they get up, and after dinner they're like, all right, now what do? Well, we're going to sit and watch TV. And so all of these things put our body into this position. When they're done watching TV, well, it's time to go to bed. So what do? They get into this position. Once again, in a spot where everything is contracted here and relaxed here. Your brain and your body work with something called reciprocal inhibition. And that's where when one muscle contracts, the other muscle relaxes. When you're sitting, these muscles are contracting and your glutes are inhibited, so they're turned off. So when you're in this position for hours and hours and hours, and Yanda said up to 23 hours in a day you're contracting these muscles, all of this is going to chronically be turned off. So when you stand up, now you have to use your arms, you're using your hamstrings, you're using your upper body to get up, and now you're in a position where everything is curved in through here because these muscles are contracted and these ones are turned off. When you get here, it puts a lot of stress into that back, and that's a big cause for low back pain. So when we work with patients, we're constantly working on shifting that pelvis back in place so that it evens out the stress and strain. Once again, on a daily basis, we need to be exercising in a position where you're in good posture to stretch out these zones. Another good chance for us to do that is how we sleep. Because like I said, you're spending 8+ hours tucked into that same position, contracting everything, creating inhibitions in through here. So if we can sleep in a better posture, that will also help us out. So Dr. Botros, tell us a little bit about ways that we can sleep.
Okay, so the three most common ways people sleep is on their back, or on their side, or on their stomach. And if you're a vampire, maybe upside down. So let's talk about some of these most common ways that people sleep and what's a good sleep position and posture to have so that these 8 hours, 6 to 8 hours that you're sleeping, you're actually not wearing and stressing the body. So there are really, really healthy, athletic patients who take care of themselves, they eat well, they exercise, they get adjusted, but they're also they're neglecting those 6 to 8 hours, and that's when you're most relaxed, and so those muscles can really sink into those poor postures. So let's get into that. So the first thing we're gonna do is we're gonna assess the posture through Dr. Van Scoyk sleeping on his side, okay?
Which direction will you want?
So let's have you facing towards the camera.
All right.
Can't have the people not seeing your beautiful
That's
face,
right?
right?
She'll want to make good people. That's right. Here we go.
All right, keep them watching. So the most important thing here is when we're sleeping on our sides, we want to make sure that our nose, our chin, and the middle of our chest all line up perfectly, okay? Now most of us, we find that we have a really fluffy pillow. So I'm going to grab another pillow here so we can demonstrate it. And we put that on here. And some people find a lot of comfort doing it this way, but can you see how that's tilting the head to the side, causing these muscles to contract here for 6 to 8 hours? And then it really stretches these muscles where they become really weak. The other extreme is some people have a really, really flat pillow, and I'm just gonna demonstrate, like that, where it does the opposite thing. This is the whole weight of the head, which is roughly the same weight as a bowling ball, 8 to 12 pounds. They're just resting, stretching, and pulling on these muscles and nerves, and it can even start to cause like radiculopathy, so numbness and tingling in the fingers. So we want to find the right kind of pillows that will help support the head in its most proper alignment. So for you, probably this one. Let's give that a try here. That seems so much better.
Much better. Even just laying in those positions feels awkward. Even as a model, it doesn't feel comfortable for me. So yes, absolutely. Trying to keep it nice and even.
It's absolutely important. Now, another thing I always recommend too is we want to work our way down. So when we're letting the shoulders just kind of collapse on themselves like that, it can put a lot of pressure on the shoulders, and a lot of us do tend to have shoulder issue, and we've all heard of the person, and you may be even dealing with this, rotator cuff issue and frozen shoulder. So let's try to take some pressure off the shoulders. A really great way to do that is to actually hug a pillow. So we'll get this pillow here again. We can give it a nice pillow. And if you're under 12 years old, a teddy bear will work just fine. So this here is excellent. And again, now it's distributing the weight evenly on the shoulders. It keeps the spine in neutral position, both in the neck and in the mid-back. Helps you breathe properly. But we got to make sure that the knees are doing well here too. So we don't want the knees to clunk with each other, which is going to put a lot of strain in the lumbar and the hip region. And so very much as you can guess, what do we need to do? You can either rotate it, or you can have another pillow on there. So you're probably gonna have to invest in the pillow market after this video. And just by doing that, you're gonna feel that you're getting way better quality of rest. You're gonna feel absolutely fantastic when you go to bed and you wake up. Anything you'd like to add to that from this position here?
Yeah, absolutely. Even just mimicking these postures, I can just feel my spine twist and curve. And once again, reinforcing those twists and curve over time just leads to all sorts of not only muscle imbalances, but joint imbalances as well.
Absolutely. So since you're here, let's have you laying on your back, please. And let's go over that here. So when you're sleeping on your back, usually what we want to make sure is that the head is, again, in a semi-neutral position, but here we do want some kind of support. And so what usually happens is the neck should have a C-curve. So if you imagine we had x-ray vision and we're looking at his neck isn't actually like this. It should actually have a curvature here. And so we want something that would support that. And so a lot of these pillows here will have some kind of curvature and contour to support that, what we call cervical lordosis, which is that healthy curvature here. And so while he's sleeping here, that support is gently lifting on the neck, supporting the vertebrae, so we're not putting stress on the nerves and ligaments that properly align that. And actually this looks pretty good. Now, some people do have low back issues, and they find it really difficult to sleep with their knees like this because it pushes on their back. And so what you can do is you can actually put a little rolled up towel or another pillow, if you have an abundance of these, below the knee here, and you're going to notice that it takes some of the pressure off the low back, and then he can just fall asleep and feel very good.
When we work with patients, we don't always take them from A to Z. We gradually move them along the spectrum to get from where they were to where they should be. And this is a great alternative to sleeping with your legs straight down. Once again, this has a tendency to return that hip flexor into a contracted or slightly contracted position, but it's once again not all the way up through here. You're gradually bringing it back down to a more level position. So this can take a lot of that stress away, especially in the short term.
Absolutely. So if you're used to sitting for long periods of time, this might actually feel comfortable for you to try it at this stage, and eventually we want to work our way to straighten it out like that. And the last position is sleeping on your stomach. So the best way to help with sleeping on your stomach is to just not sleep on your stomach. So what you're noticing here is he's putting a lot of pressure on his chest. And there's a lot of rib muscles and cartilage in the front of the chest, and so his whole body weight is pushing down here. So this can actually make it difficult to breathe. It also puts a lot of pressure on the digestive system, causing potential indigestion and acid reflux. And of course, there's a lot of rotation and flexion of the neck here, sometimes extension if you're using a pillow. That's also putting a ton of tension on these muscles and delicate structures in there. And he's demonstrating perfectly here. The hip is rotated. I mean, it's just a mess, and it may feel comfortable in the beginning, but trust me, this causes so many issues, not just to your spine, but potentially to your breathing and your digestive system as well.
Yeah, just don't do it.
Don't do it.
We just don't have patients do that.
Yeah.
So as a great alternative, it's very difficult to go from here to onto your back. So once again, in that graduated spectrum, start working on your side and then eventually move to on your back. A lot of my patients, what I'll have them do is hold on to a pillow, because holding on to that pillow gives you that same, soothing, warm feeling as when you're laying on your stomach. Plus it provides some extra weight to prevent you from wanting to roll back over onto your side or stomach. So as you transition, once again, from being on your side, having that pillow here can really help to support your body in its better posture on its back.
Now, one of the questions we've gotten here is, are there specific brands of pillows that we would recommend? My general rule of thumb is what we want to make sure is you want to get this assessed by a professional, because a lot of people have spent tons of money on pillows. They've gone through the late night infomercials, they've gone through Amazon, they've tried X, Y, and Z, and every person is going to require a different kind of pillow. So there isn't really a brand that I would recommend, but generally speaking, you want one that has some kind of contour in it, and I think I actually prefer that one more than this one here.
I was hugging that one.
So this may be hard to see, but what this does is it has a cushiony support all through here, and then it gets even less in there, and in there it's actually quite flat. So if you're laying on your back, you can actually place the back of your head right here. If you're laying on your side, you can just shift it over and you can have that support there. And this side tends to be a little bit thicker than this one, so you can actually manipulate it and find the posture that's more comfortable for you. Back.
Absolutely. Pillows are a tough one. Pillows are a hard one for us to work with. It's always one of those things that it's very subjective, and you want to make sure that you're matching up properly with the patient. So, all right. Once again, I hope that you enjoyed this. If you have any questions, please let us know.